guys, so today I want to talk about the role of family and friends in the treatment of BDD. And I just decided to talk about this because I received an email from a mom yesterday, and she was thanking me for posting these videos and for talking about body dysmorphic disorder, because she has a son who struggles with BDD, and she is really supportive to him, and that's how family and friends should be. The first thing is that, like, if you suffer from body dysmorphic disorder, you really should tell your family and your close friends, because this way they will be able to help you, or if they're not gonna help you, at least they're not going to interfere in your treatment, you know, doing something that is not good for you. So I know it's hard, it's really hard to make them understand what goes on, and because usually the comment that they're gonna get is, well, I also feel miserable sometimes about the way that I look, and I also have like my bad hair day and something like that. So you have to try to explain to them that it's not about a day, it's about your life. It's not one day that you don't feel good, it's like every day. It's an everyday fight. Yeah, so if you are a mom or a dad or a friend or a boyfriend or a girlfriend of a BDD patient, please encourage this person to seek for some help, you know, some professional help, because it's really important for a patient to be seen by a doctor. It's really, really important. Therapy is really important, because once you go to therapy, you can find the root of the problem and work on this. Another thing that I can say to someone that lives with a BDD patient is, please do not disagree with the patient's point of view, because this can cause a distortion of reality. Of course, we already have a distorted reality, but this can cause like a bigger distortion, okay? Because like, if I tell someone, well, my hair is kind of weird today, so I think I should comb it again, or something like that, this person says, well, I don't see anything wrong with your hair, then I start thinking, you know, what is real and what is not real, and it really bothers me, and it really bothers like everybody, you know, who suffers from this. Also, try to avoid taking these people to places that can trigger a BDD attack, and try to avoid watching TV shows that can trigger an attack, or even looking at magazines that can trigger this. I could remember that last weekend I was at my mom's house, and we were watching TV, so I just changed the channel, and then there was a show on, like an extreme makeover or something like that, and then she changed the channel. She said, you're not going to see that, you know, you don't need that. So yeah, this is really triggering for a patient. And another thing is regarding magazines and stuff. My mom used to be a subscriber to a magazine that is called Boa Forma, which is good shape in Portuguese. And she's not a subscriber to those anymore. And she just threw away all the magazines that she had in her house, and these ones I still have here because she doesn't know I have them. So I shouldn't be looking at these magazines, because they are really triggering. You know, once you see that, you know, all these people on their covers are all perfect and beautiful, and they have this beautiful body and this beautiful face, and the hair is just great, and then it says here, you know, 3 tips to lose weight fast, and everything for your transformation and things like that. So it's not good, and this is a good one. Okay, take a close look at this girl. Okay, she is a singer, a Brazilian singer, and now I'm going to show another picture of her right here. Okay, this is the same person. Okay, can you see anything different between this and this? No. I can say that the guy who used Photoshop in this picture didn't do a good job, because in this one she has a piercing. She has her belly button pierced. And in this one she doesn't have her belly button pierced. So Photoshop, and a couple more here. Another thing that I can say is just like, please don't make comments about the way that people look in front of BDD patients, or at least try to avoid them. You know, don't be pointing people for being beautiful or not beautiful. And also don't make comments about the way that the patient looks. For example, my mom used to always find a mistake in, like, I don't know if you guys can see, but I have a mark here. It's because we're having like this massive invasion of mosquitoes in the south of Brazil. So I got stung by one here. And my mom in the past should come to me and say, what is wrong? Why do you have that mark in your face? You know, and this can ruin a BDD patient's day, you know, because then, like me, now I just showed it, and now I just want to hide it. So, yeah, hair is good. Okay. And another thing is, like, every time you talk about someone, try to focus on this person's personality and not in the way that he or she looks, because yeah, we have to see that the world is not about appearances. The world is about the person that we really are inside and not outside. And I'll try to think of some other tips that I can give to you. And if I can remember anything, I'll be posting a new video. Okay? So thank you guys for listening, and I'll talk to you soon. Bye-bye.